In a recent and deeply concerning development, Kerala has been named the Indian state with the highest number of drug-related cases, according to the latest figures presented in Parliament. Once known primarily for its high literacy rate, strong healthcare system, and tourism, Kerala is now under the spotlight for an entirely different reason: a growing drug crisis. Between 2022 and 2024, Kerala registered over 85,000 cases under the NDPS Act. That's the Narcotic Drugs and Psychotropic Substances Act. To put this in perspective, Maharashtra, with a much larger population, reported around 35,000 cases in the same period. Punjab, a state historically associated with widespread drug abuse, reported even fewer. In 2024 alone, Kerala logged nearly 27,700 cases, marking an explosive 300% increase in just 3 years. This sharp rise has sent alarm bells ringing. Experts say this isn't just about urban trafficking rings or coastal smuggling routes. It's a deepening social issue affecting people across age groups and economic backgrounds. From party drugs among youth to synthetic opioids, the spectrum of substance abuse is expanding fast. But here's the twist. When we shift the lens from total numbers to per capita usage, it's India's northeastern states that show even more alarming trends. According to multiple health and narcotics studies, states like Mizoram, Nagaland, Manipur, Arunachal Pradesh, and Sikkim report opioid use rates as high as 4 to 7% of their population. That's nearly 10 times the national average of just 0.7%. This tells us that while Kerala may be the administrative epicenter of drug-related cases, the depth and pervasiveness of substance abuse in India is far more complex and spread out. Behind the numbers are stories of broken families, lost youth, overwhelmed rehab centers, and often a lack of consistent mental health support. It's not just a law and order issue anymore, it's a public health emergency. How do other states compare? Despite its population size, Punjab, historically known for its substance abuse problems, logged just 9,025 NDPS cases in 2024, down from over 12,000 in previous years. Yet, it remains a major concern, especially given that Punjab alone accounted for 144 out of 681 overdose deaths recorded nationwide in 2022. Maharashtra, one of India's most populous states, reported 13,130 NDPS cases in 2022 and continues to feature high on the list, especially in urban hotspots like Mumbai. Here's a comparison of NDPS case data from 2024, approximate or reported figures. Kerala, 27,701 cases. Punjab, 9,025 cases. Maharashtra, 13,000 plus cases. Rajasthan, 5,462 cases. Haryana, 3,062 cases. Himachal Pradesh, 1,634 cases. Uttar Pradesh, several thousand cases, exact data not disclosed. These numbers paint a concerning national picture, though Kerala remains the clear outlier in sheer volume, arrests, and national enforcement. According to Lok Sabha data, here's how arrest numbers looked in 2024. Kerala, 24,517 arrests. Punjab, 9,734 arrests. Maharashtra, 7,433 arrests. These figures show not just the scale of the problem, but also the statewide emphasis on law enforcement under the NDPS Act. At the national level, total drug-related cases dropped slightly, from 109,546 cases in 2023 to 89,913 in 2024, suggesting better awareness or a shift in reporting, though high-incident states still drive the majority of figures. Northeast states, the hidden crisis. While Kerala and Punjab lead in total cases, a deeper crisis brews in the Northeast, especially when analyzing per capita prevalence of opioid and sedative use. According to the All India Institute of Medical Sciences, AIIM's 2019 Drug Use Survey, the following states reported extremely high opioid dependence rates: Mizoram, 6.9%, Nagaland, 6.5%, Arunachal Pradesh, 5.5%, Sikkim, 5.1%, Manipur, 4.0%. In contrast, the national average stands at just 0.7%. Sedative use is similarly high in these states: Sikkim, 8.6%, Nagaland, 5.4%, Manipur, 4.3%, Mizoram, 3.8%. These numbers indicate that while enforcement may be focused elsewhere, the Northeast faces a silent epidemic with few institutional resources to match the demand for mental health support, rehabilitation, and addiction care. India's drug crisis can no longer be viewed through the lens of traditional hotspots. While Kerala leads in total cases and enforcement, the Northeast states quietly suffer from the highest per capita drug dependency, pointing to structural gaps in healthcare, policing, and outreach. The situation calls for more than just arrests and crackdowns. What India needs now is a public health-centered approach, one that combines education, rehabilitation, mental health care, and community awareness. If ignored, these numbers will only climb higher. Behind every case is a human story, a youth, a family, a community torn apart. It's time to act before these stories become the new norm. India's drug problem is no longer someone else's issue. It's here, it's growing, and it demands action before more lives are lost.